Charles Cullen, known infamously as the Angel of Death, stands as one of the most prolific serial killers in American history, cloaked under the guise of a trusted nurse. Over a 16-year career in various hospitals across New Jersey and Pennsylvania, Cullen was involved in the deaths of potentially hundreds of patients, though he was officially convicted of dozens of murders. His method of choice was tampering with medication and intravenous supplies, making his crimes not only heinous but also insidiously covert. The chilling paradox of a caregiver-turned-predator and the systemic failures that allowed his spree to continue undetected for years paint a harrowing tale of betrayal and tragedy in the medical community. This story delves into the life of Charles Cullen, exploring the dark path he traversed and the profound impact of his actions on the victims, their families, and the healthcare industry.
Charles Cullen's life story unfolds like a grim paradox, a nurse who took life instead of preserving it. Born in 1960 in West Orange, New Jersey, Cullen's early life was marked by hardship and tragedy, including the loss of his father at a young age and a tumultuous family life. Despite these challenges, he pursued a career in nursing, a profession synonymous with care and compassion. However, the caring facade masked a dark reality. Beginning in 1987, Cullen embarked on a deadly path that spanned over 16 years and numerous hospitals in New Jersey and Pennsylvania. His method of murder was sinister and subtle. He administered lethal doses of medications to unsuspecting patients, exploiting his position as a nurse to carry out his crimes unnoticed. Cullen's actions were not crimes of passion or sudden violence but calculated interventions that left a trail of unexplained patient deaths in their wake. The ambiguity of these deaths allowed him to evade suspicion for years, as the nature of his methods blended in with the medical environment where life and death decisions are routine. The extent of Cullen's crimes began to unravel in 2003 when a colleague at Somerset Medical Center in New Jersey noticed irregularities in medication records. This led to an investigation that unveiled a horrifying pattern of intentional overdoses connected to Cullen. When confronted, he confessed to killing as many as 40 patients, although experts believe the actual number could be much higher, possibly in the hundreds, making him one of the most prolific serial killers in American history. In 2006, Cullen was sentenced to 18 consecutive life sentences without the possibility of parole, a verdict that brought a chilling chapter in the annals of American crime to a close. However, the story raises profound questions about the vulnerabilities in the healthcare system that allowed such a predator to operate undetected for so long. The aftermath of Cullen's capture led to significant scrutiny of hospital hiring practices and the mechanisms for reporting suspicious behavior among healthcare professionals. His case is a stark reminder of the delicate trust placed in the hands of those tasked with caring for the sick and vulnerable and the catastrophic betrayal of that trust by one man. The tale of Charles Cullen is a haunting narrative of how evil can lurk in the most unexpected places, hidden behind a mask of benevolence and care. 1. Profession as a nurse. It's particularly disturbing that Cullen was a nurse, a profession dedicated to healing and care. His role as a healthcare provider, which should symbolize trust and safety, makes his crimes profoundly shocking. 2. Length of killing spree. Cullen's ability to continue his lethal actions undetected for about 16 years across multiple hospitals indicates a remarkable and disturbing level of deceit, as well as systemic failures within the healthcare institutions. 3. Number of victims. The ambiguity surrounding the total number of Cullen's victims adds a chilling layer to his story. While he confessed to dozens of murders, experts believe he may be responsible for hundreds, making him one of the most prolific serial killers in American history. 4. Method of murder. Cullen's method of killing patients by tampering with their medication is particularly insidious. This approach allowed him to remain under the radar for years, as these actions could be easily disguised as medical complications or errors. 5. Whistleblower aspect. The fact that it took a fellow nurse's suspicions to finally bring Cullen's actions to light underscores the importance of vigilance and ethical responsibility in the medical field. 6. Psychological profile. Unlike many serial killers who seek notoriety or have a clear motive, Cullen's motivations remain murky. He claimed his actions were mercy killings intended to spare patients from suffering, a rationale that conflicts with the nature of some of his victims' conditions, adding a complex and puzzling psychological dimension to his crimes.